Good afternoon to all. Boa tarde a todos. Welcome to the second conference on state fragility. I will just say some words here in Portuguese, but we will do this panel mainly in English because all our panelists understand English and speak English. Estava a dizer que vamos fazer este painel em inglês porque a maior parte dos nossos participantes, todos os nossos participantes neste caso, fala inglês, mas só aqui uma nota em português, relembrar a existência de interpretação, de tradução simultânea apenas na plataforma de streaming, State Fragility 2021.digitalstream.pt, acho que é isso. I was saying that I want to remember that for our guests and for the ones attending this conference online, there is a possibility of having simultaneous interpretation only on the streaming platform. It's statefragility2021.digitalstream.pt. And but I would like to thank everyone for attending, and especially our panelists. Today, we are analyzing the implications of the pandemics and the vaccination and solidarity in fragile countries. One thing we surely understood with this pandemics is that no one is safe until everyone is safe. So it's especially important to be able to share and to show solidarity with fragile countries. We will also speak a little bit about the role of international cooperation, especially important in a situation like this one, and the impact of geopolitics and diplomacy, and also the economic impact. But on this panel, on this specific panel, we will look at the implications of the pandemics and vaccination on the public health service of fragile countries. Many questions to discuss for sure. Is free global vaccination guaranteed? How to reinforce public health systems in fragile countries? Is it possible to increase vaccine production without a patents waiver? Lots of questions, and to help us navigate through these questions, we have with us our panelists. Olivier Bailly is head of the EU Task Force on Vaccine Strategy. Alex de Jonquière, the Director of Health System and Immunization Strengthening at Gavi, the Vaccine Alliance, and Céline Mias, she's currently EU Representative and Director of Care International, of Care International's EU office in Brussels. Unfortunately, we were supposed to have another participant, Wilhelmina Jallah, the Minister of Health of Liberia, but unfortunately she wasn't able to attend, at least until now. So it's a pity, but I'm sure we will have a very nice discussion with our panelists. I will start with you, Olivier. And my first question is, in the difficult balance between vaccine diplomacies versus solidarity, where does the EU stand? It has been criticized to be lagging behind Russia and China, but can we say the EU is leading the solidarity battle globally?
Thank you, Elena, and thank you for the invitation to this interesting panel. Very happy to be here. It's true that when the task force on vaccine strategy was set up last January by the High Representative, Mr. Borrell, and President of the Commission, Madame van der Leyen, the main question was that China and Russia seems to be ready to vaccinate the world with Sputnik, Sinopharm, or Sinovac, and that the EU, although we were contributing to COVAX facility, the main international instrument to distribute vaccine around the world, it seems that we were just talking and there was no concrete action from the EU. And in many media and in many social media, there was this criticism that the EU had no vaccine strategy, and that vaccine strategy seems to be the instrument to first vaccinate the world, but also to lead the vaccination campaign around the world. From the beginning, we decided that vaccine strategy was not a concept that we were buying, because what we saw from Russia and from China was more than a vaccine diplomacy. It was a sort of trade-off, trying to exchange donation or exports of vaccine from these two countries against other aspects of sovereignty, being money through very expensive loans, or access to markets, or selling of some natural resources, or diplomatic elements like non-recognition of Taiwan, or recognition of Crimea as Russian sovereign territory. So this bargaining was for us the contrary to the solidarity effort that we wanted to make. This exchange of privilege or access to different resources beyond health was not something in which the EU wanted to enter. So from the beginning, we said that the EU will not have a EU vaccine diplomacy. And we will continue, as we were doing since May 2020, to continue to call for everybody to support the global vaccine effort. Because as you said, no one will be safe until everybody is safe. This sentence, as we have all repeated so much, that sounds now a bit used and overused, but there is a fundamental truth that this disease is global. This pandemic is global, so it needs a global answer based on solidarity, on international cooperation. This is why the EU has chosen COVAX and Gavi. I'm very happy that Alex is here to answer also a question on this. We have decided to have a global answer and not a strategic identified delivery or exports to some specific clients, specific targets around the world that would be more important for our diplomatic interest. Everybody is important. As much people as possible, as much country as possible should be vaccinated. And we do that through COVAX, obviously, but also through our exports. And now the commitment we have taken for 100 million doses to be shared until the end of the year. So it's an important conceptual difference between what Russia and China are doing and what we are now doing also with the US that are back in game. So, and we are quite proud, actually, not to have an EU vaccine diplomacy.
When we are still vaccinating and trying to vaccinate all our population, I'm being the devil's lawyer here. When we are still trying to vaccinate our population, how difficult is it to explain people that you have to be be generous and you have to help others, even if you are not still totally vaccinated? How difficult is it to explain that to countries and to leaders and to populations?
No, that's a good question. And to be honest, the question was there in the mind of many leaders, many EU leaders that saw from January and February the opportunity to express this solidarity, but they needed to reach a certain level of vaccination domestically. And different leaders decided differently, to be honest. But to express their solidarity to different parts of the world. Some public opinion, like Portugal or Spain, reacted very positively when Prime Minister Costa or Prime Minister Sanchez decided to announce that they will share 5% of their doses to Lusophone countries around the world or to Latin America. It was perceived as a sort of generous move to their cousins or brothers around the world that diplomatically and politically we share common values and they wanted to be helped. In other countries, it's true that leaders had to wait a 40 or 50% of first vaccination to allow themselves to bring this debate publicly into for the public opinion. It also depends countries where they are soon or there have been national elections to avoid that some political parties take this news or this announcement as a sort of political negative news. So different countries reacted differently. Some countries started to share already in March, April, like France with Africa through COVAX. Others are now starting to consider this. But 3 weeks ago, the European Council, the meeting of the 27 EU leaders, decided collectively that they would share at least 100 million doses through COVAX with the rest of the world. So it takes different ways, different timings, but here they are collectively, they have decided early June to do this together.
Thank you. Thank you, Olivier. I will go back to you. Now I will go to Alex because it goes in the way we were talking. Alex, how does this pandemic affect health systems and immunization? That's my first question. Can you explain us?
Thank you, Helena, and it's a pleasure to be here. Every outbreak and every epidemic causes massive disruption to health systems, and not just health systems, but to the communities which they affect. And I think we're seeing this at an unprecedented scale with COVID, but we see it routinely with other diseases, from Ebola to measles to yellow fever. Many of these are diseases we don't see so much in developed countries, in high-income countries, but we do see still in a number of other countries. And I think it's important to remember that COVID is the pandemic that we're all focused on right now for obvious reasons. The threats of these other outbreak-prone diseases remain very real in many countries. And I'll talk more about that in a second. I think it's also important to remember that this pandemic's highlighting not just how disruptive outbreaks can be to health systems, but also how critical health systems are to preventing and controlling outbreaks. And I think we need to look at it both way rounds. COVID has in many ways been the sort of the uber example of how outbreaks and epidemics can affect health systems. And immunization was particularly affected partly because of the way immunization is delivered in many countries, which is often through outreach services with health workers going into communities. And that kind of mobile strategy was particularly hard hit in particularly the first wave of COVID. And so what we saw and continue to see as we experience new waves is multiple different elements of the health system and of the immunization program being affected. So health workers were diverted from the routine services they typically provide to COVID response, and health workers who were among the highest risk were getting sick as well and dying, and so that was reducing the capacity to deliver health services. Supply chains were disrupted both within country but also internationally with the massive shutdown of air travel, and that made it harder to get commodities to countries. Lockdowns, which were imposed in a number of countries, made it hard for health workers to get to service delivery sites, but also for communities to come and seek services. And there was also a major impact on demand for services because communities were fearful, understandably, of the risk of exposure to the disease if they were to go to health facilities. And unfortunately, we've seen a lot of rumors also associated with this pandemic and subsequently with the vaccines. And so all of those combined to mean that we saw about a 40% reduction in immunization activities in the first wave. And Bill Gates declared last year that we'd lost 25 years of progress on immunization in just 25 weeks. The good news is that the immunization at least bounced back pretty strongly. And actually by the end of last year in the countries that Gabi works with, we were seeing immunization activity back to or even slightly above where it had been the year before as countries caught up. And so, for example, in Liberia, which unfortunately the minister is unable to join us, they saw coverage drop by about 15 percentage points in the first wave of the pandemic. But they've subsequently, with support from Gavi, been running a number of intensified routine immunization sessions, which have helped them catch back up on many of the kids who were missed. And so we've seen a real resilience to the health system, even in countries where it may not be as strong as elsewhere. And I think that resilience is really important because, as I said before, it's not just about how pandemics affect health systems, it's about how health systems help us to control future pandemics and outbreaks. And to be able to do that, we need to think about equity, and we need to think about the equity of health systems. Of course, right now, our focus when it comes to equity is on COVID vaccines, and that's entirely understandable given where we are. But we shouldn't lose sight also of the equity of other health services and other immunization services. Before the pandemic struck, even in the world's poorest countries, over 80% of children were being reached with a full course of basic vaccines. And that was allowing us to maintain herd immunity against a range of diseases in many countries, that could cause outbreaks if those vaccines weren't being delivered. And vaccines have also proven to be one of the most effective mechanisms for preventing or responding to new pathogens when they emerge, as we're seeing with COVID, but we saw with Ebola beforehand. And so having those really strong and equitable health systems is critical to be able to respond to pandemics. But 20 million children every year, even before COVID, weren't being reached with even basic vaccines, and 2/3 of them weren't getting even a single dose of vaccine. And for us, that is really a critical agenda for us, both from a child mortality point of view and from an outbreak prevention point of view. Because if we want to, those children, they're about 15% of the population, they account for about 50% of deaths from vaccine preventable diseases. So if we want to reduce child mortality, those are the children that we need to reach. 2/3 of them are below the poverty line, and they're often in very marginalized communities. But they're also the children we need to reach if we want to prevent outbreaks and control pandemics, including the current one. They live in communities who are not being reached by health systems. And so if we don't reach them, they will continue to be exposed and at risk to this disease, and it will continue to circulate, as will other infectious diseases. And so it's absolutely critical that we focus on those communities which are being missed, whether these large numbers of zero-dose children reside. So I think for us, COVID is shining a light on a problem that already existed. It is a huge strain on health systems, but it is also an opportunity for us to really build back better. And Olivier talked to one overused phrase, build back better is probably another overused phrase. But I think it's true. Never before have we had this level of political focus on primary healthcare and the importance of equitable service delivery. And we need to capitalize on that to ensure that we don't just try and deliver equitable COVID vaccination, but equitable primary healthcare. By regularly reaching these communities with immunization to begin with, we're building a platform with health workers and supply chains and community engagement that can deliver other primary healthcare services, make countries more resilient to future outbreaks, but also make them wealthier and more stable going forward. Because we know, for example, that every dollar invested in immunization yields $20 in economic benefits. And we also know that immunization is one of the first health services of any kind to reach many communities. And so if countries receive trusted and high quality immunization services, that can help build public trust in the broader health system and institutions. So building this resilient health system that can help reach every community is both our best chance of managing and controlling this pandemic, but also controlling those in the future.
So, like you said, this pandemic can be an opportunity, and we can learn from what we are living right now. But do you think that in the future, people tend to forget easily? So do you think this experience that we are all living can really change the mentality and the way we see those fragile communities and those children who need our help even after COVID and after this pandemic?
I would love to say that every problem will be solved and we'll all remember everything. I don't think that's the case, but I do think there's reason for optimism. I think both because of this pandemic, but also where we're coming from. If you look at, if I talk about the number of zero-dose children who I mentioned before, the children who aren't getting a single vaccine, we reduced the number of zero-dose children in the world's poorest countries countries reduced the number of zero-dose children by 20% over 4 years before the pandemic came out. And so that's a pretty rapid decline. And that's despite significant growth in population in those countries. And so I think we were already on the right track. The question is, can we ensure that we use this pandemic as an opportunity to accelerate progress rather than something that really slows us down?
Thank you. I will go back to you and for you to explain us how Gavi engages really in context of fragility. But before that, I will go to Celine, because one of the questions I would want to ask you, Celine, is how can we ensure a fast and equitable access to vaccine in fragile countries, which goes in the same direction that Alex was talking about?
Yes, thank you. Thank you very much. I would just first like to mention that while I work for Care International, I'm also here in my capacity as Vice President of Concord Europe, which is the confederation of NGOs working in international development from across Europe. And I represent over 2,500 organizations. I can't say I represent all of civil society on this issue, but certainly here representing Concord. I just wanted to mention that. In terms of fast and equitable access to vaccines, first of all, if we want to control the COVID-19 pandemic, we really need world leaders to take global action on equitable global access to the vaccine, but also to make critical investments to ensure fair and effective delivery of vaccines to all. And I want to touch on a few points. One is on vaccine sharing. We know that the G7 leaders committed to share at least 870 million doses directly over the next year, and to deliver at least half by the end of 2021, primarily channeled through COVAX towards those in greatest need. And thankfully, the EU has committed 100 million doses, and others, of course, have stepped up to this 870 million. But we feel this is far from enough, because dose sharing is urgently needed now. It's not needed next year or over the course of the next year, and it's not a long-term solution. We really need to plug the significant vaccine supply gap, which is essentially caused by rich countries who are massively overbuying and hoarding doses. And I really thought it was interesting how we started on the whole question also of how to even sell the notion of solidarity of vaccines. But I think we also have the how to say, as you started, that none of us are safe until we're all safe. I think that is something that is actually also fairly easy to understand. The New York Times vaccines tracker reported, and here I want to quote, that 85% of shots that have gone into arms worldwide have been administered in high and upper middle income countries. And only 0.3% of doses have been administered in low income countries. So at current vaccination rates, low income countries would be waiting 57 years for everyone to be fully vaccinated. So clearly on vaccine sharing, more ambition is needed to meet the urgency of the moment, and especially to address vaccines in the most fragile contexts. But also I should say that they don't just, these countries, I don't think they just want our leftovers. We have to plan properly to ensure more equitable vaccines access globally. I've read that we have enough doses already in Europe, in the EU, to vaccinate people 2 times over, while the UK and the US could vaccinate their entire populations at 70% 4 times over. So increased ambition on vaccine sharing is possible. Another point that is essential that I want to mention, because not only is vaccine dose sharing critical, sufficient support is needed to prepare countries to deliver the vaccine. And this is also really linked to this whole issue of health systems, which I think we'll be talking about even more. But this is especially important for those with chronically under-resourced and fragile health systems. And it means that donors need to provide funding to cover the real costs of delivery on the ground, since the low and middle income countries, and especially fragile countries, won't be able to do that themselves. A recent report by CARE International estimates that for every $1 a donor or a country government invests in vaccine doses, lower and middle income countries need to invest $5 in delivering the vaccine. But we know this investment is not forthcoming, and it's not happening at the pace that is required. So for instance, tragically, we've heard that 76,000 vaccines in Malawi and South Sudan expired before health systems could deliver them, while DRC had to return over 1 million doses, which it was unable to deliver due to its weak health system. So really investing in the delivery is critical to ensure that the vaccines can reach all who need them. And if I may I have one last point I'd like to make on this issue is around the vaccines production, because on the whole issue of equity, we also strongly believe that vaccines should be available for all as a common global good, and that this will only be possible with a transformation in how vaccines are produced, including through the fact that pharmaceutical corporations, to do that, must allow COVID-19 vaccines to be produced as widely as possible by sharing their knowledge free from patents. But it's not only about the patent barrier. The entire supply chain needs to be made monopoly free in order to ensure this access. And that includes export and import barriers, among others. And we know that progress has been made on IPR related to manufacturing and global supply of COVID tools. The Biden administration recently expressed its partial support for the World Trade Organization COVID-19 TRIPS waiver proposal, and that some EU countries have also supported this Biden proposal, Belgium, Sweden, France, Denmark, Spain, and possibly others. Apologies if I miss them. But also the European Parliament has voted in favor of a proposal calling on the European Commission to support the lifting of patents for COVID-19 vaccines and medical equipment. Now, the EC on its side, the Commission, has presented its own proposal, but we don't see actually anything new in that proposal. It only addresses patent barriers and is quite limiting. So just the last point on this is that we really expect more progress on these discussions to ensure that vaccines can be produced globally and equitably and where they are needed across the world to benefit all. And in particular, we would like to see EU and rich countries support a TRIPS waiver for the COVID-19 pandemic. So I'll stop there, just a few points, and I'm also keen to discuss more about the public health systems later in the.
And we will go back to you, Céline. Let me just remember our public that you can ask questions. So feel free, please send us your questions, and I will ask them to our panelists. But just before I go back to Olivier, just one last question, Céline. You were talking about of course, the difficulty of fragile countries' health systems to manage all the not just the giving the vaccine, but all the process. Do you think developed countries should help, and how can they help in that sense? Not just giving the vaccines, but also helping in forming and developing the health systems of those countries. And like Alex was saying, is this the opportunity to do that?
Absolutely, and this is really another issue that I wanted to get to, is that and absolutely also agree that with Alex that COVID-19 has affected health systems, but it's also really an opportunity, and I should say probably all of the tragic diseases, that's infectious disease outbreaks that we've seen, have at least contributed some knowledge and some learnings that have helped us to move forward, and that's certainly the case with the COVID pandemic. But what it has really pointed to for us is that we urgently need investment in public health systems. So COVID has shown us the importance of a robust and well-funded and resourced public health system, and the need for it to be accessible to everyone, free at point of use, and that we really can use the experience of the pandemic to create resilient and universal, equitable health systems around the world, as you were saying. But one point I would like to make here, and this is where we can a lot more support can be provided. Critical to the health systems are its health workers. It really has become clear in this pandemic that frontline health workers in particular are the linchpin of effective prevention and vaccines delivery, including issues such as building community awareness and vaccine acceptance and reaching rural and underserved communities. I mean, I think this links to what Alex was also mentioning in terms of how vaccines can be an opportunity to reach marginalized communities, but we also really need the frontline health workers to do that. And yet frontline health workers are overlooked, or routinely overlooked, I should say, and chronically underfunded. And certainly in this vaccine, we know that health workers in this pandemic, that we know that health workers in at least 84 countries have gone on strike during the COVID-19 pandemic due to issues such as unfair pay and unsafe working conditions, lack of personal protective equipment. And there's another issue around health workers I would like to mention, which is a big gender inequity, the inequity element to health work. Because on average, women healthcare workers earn 28% less than their male colleagues. That's a massive pay gap. And that we know that women make up a large proportion of health workers in most countries. So really investment in health workers and in health systems, but really in the human resources is incredibly important. But I'd also just like to point out this learnings, another learning beyond the need to support health workers, just that the experiences of some sub-Saharan African countries in handling other diseases, in managing other infectious diseases such as Ebola, tuberculosis, and even HIV, have served in the fight against COVID. And they also point well to us what can work in fragile contexts. And when we talk about this building back better, we can really learn from what's already worked. In some countries, for example, Sierra Leone, pre-existing emergency plans on public health interventions, on community engagement programs, and also workforces of emergency medical personnel, trained healthcare workers, they were quickly redirected to ensure a fast response to COVID-19. And we do know that this investment in health systems can deliver. In Rwanda in this pandemic was able to use 100% of the vaccine doses they received through COVAX in about 3 weeks because they had invested in healthcare workers and in robust delivery systems. So I say let's learn from what works well and what hasn't worked well. And we just need to ensure that the public health systems in fragile states and in the poorest countries that they need support to be upgraded and expanded with global financial support, while also learning from experiences in neighboring countries and in other fragile states, so that we can prepare for similar outbreaks in future. And this really does ensure equitable pay and safe and supportive working conditions for health workers, including women health workers, of course, because they are on the front line of response, whether it is to COVID or to other diseases, whether it is to immunization or longer term health, public health initiatives. Frontline health workers really need that support and need to have conditions conducive to their work, including support for childcare, hazard pay, funds for health-related expenses, but also, again, this safe working environment is critical. Over.
Thank you, Celine. Well, talking about solidarity, Olivier, I will go back to you. What are the EU global priorities for this second half of 2021 and 2022 when it comes to vaccine solidarity?
Thank you, Elena. And I will use the opportunity of your question also to pick up on a few elements developed by Alex and Celine. First, when it comes to fragile country or vulnerable countries, we need maybe also to pause a bit on what are the criteria to define these countries, because I'm not sure among us three we see this the same way. Is it the number of cases? Is it the number of death casualties? Is it the number or the limited access to vaccine due to lack of financial resources? Or is it the exposure of some negotiation through China and Russia that the EU or the US should be there to offer a counterpart? Is it the weakness of the health infrastructure? Is it vaccine hesitancy that has not been mentioned yet, but which is a huge problem in many vulnerable countries where we have delivered vaccine, but not only because of weak infrastructure, but because people do not see the need or do not want or are under misinformation or disinformation in some countries? Or is it the lack of local production or regional production of vaccine? All these criteria are important for us when considering which country should be priorities. We have made a choice, as I said at the beginning, that we will rely on COVAX and on Gavi to identify where are the needs and to ensure the equitable access and the fair access to vaccine. So when we give 3.2 billion euro to Gavi to finance COVAX to attain the very ambitious target that they have for 2021 for all the shareholders, but in particular for the 92 less privileged countries in the world, or when we give 100 million doses, or when we finance with 1 billion euro vaccine production in Africa, in specific countries where there is already vaccination production facilities, or when we support Spain to give 7.5 million doses to Latin America, we try to have this comprehensive approach. Of course, and I'm a bit sad, but I have to live with the political reality, Europe cannot vaccinate the world alone. And there is one fundamental reason that I need to recall is that 1 year ago, Europe was the continent most hit by this pandemic. We were exiting 2.5 months of lockdown, where we witnessed thousands of deaths every day. Let's remember these images. And our leaders, our public opinion, were under the shock of a huge pandemic, never seen since a century in Europe. And we needed, as a EU, to take decision to vaccinate our continent. Is it a lack of solidarity? I'm not sure. This is political responsibility, and our citizens were expecting this. And to come back to your question, Elena, it was already difficult this spring to help our public opinion to move to solidarity while getting vaccinated. It would have been impossible last year while we were just exiting a pandemic and so many thousands of dead people and in our continent to launch a huge solidarity effort. What we did was to create COVAX to provide finances, but the focus was on Europe last year. I'm glad that he has moved away, in a way, but we are able now to provide this solidarity effort. But let's not forget that last year we were the central point of this pandemic globally. Let's remember Italy, let's remember Spain, let's remember Portugal and France. And that is a shock for our public opinion. And I'm impressed that out of this crisis last year, EU was able to trigger this solidarity message. And this is, for me, a huge lesson. I don't know another continent, to be honest, that is able, out of its domestic crisis, to send this message to the world that we need global solidarity to vaccinate the rest of the world. Most of the continent, or most of the big G20 countries that we see now, hit by the crisis, I don't hear this solidarity message. So I'm quite proud that we have been able to deliver this, and we have been the first. And this also should be acknowledged as a lesson. Of course, we need to do so much more. And let's also be realistic. This task is with us for several years. We will not end this global pandemic by Christmas this year. Probably not also by summer next year. We need to accelerate. We need to do much more. We need to protect everybody, but we need a global effort. Again, Europe cannot do anything, and we are doing a lot. I think we are doing the most we can do. We need to accelerate. Céline is right, but let's be realistic also, and let's program what we can do in a realistic way, knowing what are the conditions on the countries where we want to deliver this vaccine. And that is probably, Elena, the first priority. Where can we have a decisive value added for the populations? Being the health workers, people in the cities, the families, people in the countryside, where it's sometimes very difficult to deliver vaccine, with Gavi and COVAX, or bilaterally, as EU member states can want to do sometimes. This is for us the main priority is where can we have a value added through COVAX or bilaterally? And all the criteria I have mentioned, the vaccine hesitancy, the situation of the health infrastructure, the situation of health workers, the capacity to have access to vaccine through COVAX or another way, who is going to reach 20% of its population vaccinated before the end of the year? Not so many, contrary to our plans. So should we focus on this? Should we focus on the countries that are most hit by the pandemics? Brazil, or now in Africa, Zambia, or Namibia, or Liberia, or South Africa, or Tunisia? Should we focus on the countries that are closer to our borders and that want to have access to the Schengen area? Again, the Western Balkans, the Eastern Partnership, the southern border of the Mediterranean Sea. Member states are debating that. And I would not tell you a big secret of EU politics that they need to discuss to find a compromise. Let's put it that way.
And it takes time, It takes time.
There is one point on which they agree, and I'm very glad for that, humanitarian situation. This is a central thing on which EU, member states, leaders, ministers, administration come back to their core values. If there is an humanitarian situation, we find often 27 countries ready to help. And that is also an important message, that throughout this crisis, for Timor-Leste or for other situations like this, or Papua New Guinea, we find member states ready to support. So to answer your question in a more Cartesian, rational way, first priority, humanitarian situation. Second, where there is a need, and we see that for the time being, for example, in Tunisia, or in Liberia, in Namibia, where the pandemic is hitting hard in countries that are not ready to face this. And not only, Céline is absolutely right, and Alex also, providing vaccine is already quite difficult, but it's not enough. If there is no one there to deliver this vaccine, to inoculate this vaccine, to make sure that the first and the second doses will be tracked, and that there is not, sorry also to mention that, illegal trafficking from the airport to other populations, that is not a secondary market of reselling and that some traffickers get money out of that, to make sure that the doses are not destroyed because they have reached supposedly expiration date. We need to have a more comprehensive strategy when it comes to not only vaccine delivery, but vaccination process in these countries. Because again, bringing this vaccine to the tarmac of these airports is just the entry point of a process that takes longer. Then also we have to be careful, and this is where disinformation and communication are key. EU support, direct or through COVAX, has to take into account the public opinion of these countries. So not only our country when it comes to be generous or solidar, but in these countries. It's not obvious for Spain to deliver vaccine in Latin America. Not all Latin American countries would welcome this. I don't know about Portugal and the Lusophone country, but we have to be careful that this is not perceived as a political gesture that may bring back this country to previous decades or previous century. In Africa, and I can tell you for Francophone countries, it's extremely sensitive. Especially, and we see that in Africa, vaccine hesitancy in Africa is mostly, not exclusively, but mostly a phenomenon in Francophone African countries, because they are influenced by the French debate on vaccine hesitancy, country of Pasteur. But we have to be careful of that. And Céline made a point, and I think I understood a remark that way, not to give the impression that we donate the leftovers. I guess you were referring to AstraZeneca, because we are already financing COVAX to deliver COVID Shield. And COVID Shield is not authorized yet in the EU. We are in the process of making it authorized by the European Medical Agency. But AstraZeneca, who is the owner of COVID Shield, has not asked Europe to recognize this vaccine. And therefore, we are in this odd situation that we are financing COVAX to deliver a vaccine that we don't recognize ourselves. It's not our fault. We are in a legal trap here, and I hope we will find soon a solution. But of course, if we are an African citizen that want to vaccinate your parents and your family, you have doubts. And it's very easy for Russia or China to put some ideas in the social media, which are quite influential also in Africa, that Europe is giving the leftovers of things that we don't even want ourselves. And then that is quite difficult. So our priority is also this, not only to ensure that vaccine delivery can become vaccination process, and we do a lot with our financial means and our delegation on the ground and the support of other international organizations. But we have to take care also about the capacity of people to go into vaccination before the pandemic hit them, because it should be a preventive thing. In Europe, it was a sort of reaction. For other continents, we should try to tell them, which is very difficult, this is a tool for the future. You should protect yourself before the pandemic reach you. Like we didn't do that in Europe. We started vaccination when thousands of people were dead already. So don't learn the same way as we did, because we were not prepared. You are not prepared, it's true, in Africa or in other continents, but we were not prepared to, and we pay a high price for this. So we can have a common agenda and not divide this. Then there is a question of production, and I finish on this, and the intellectual property. Production is indeed very concentrated in 5 countries in the world. It's basically the US, who until a few days ago could not export their production or their excess of production, thanks to President Trump. Now, the Biden administration is turning this around, but they are just starting. EU, and we're exporting so far around 400 million doses to the world, to 47 countries. India, who does not export for the time being due to their pandemics until October and maybe beyond. We need to look that very carefully because it's a problem for Gavi and for COVAX. China, who has exported as much as Europe while vaccinating its own population. And Russia. Russia is very interesting because they communicate massively, but they produce very little. And they have delivered so far only 2% of their contracts with the world. Well, as I said, we started the year by thinking that Sputnik was spreading all over the world and that the world would be vaccinated with Sputnik and Sinopharm. This is a political and diplomatic lie. The misinformation is there. So basically, who is vaccinating, who is producing and exporting now to the world? China and the EU. Only them. It's a huge pressure on 2 producers. And we have this debate on intellectual property, which is very complex. And I'm glad that we have been able to get out of the games of some powers who seems to support the idea coming from India and South Africa, while they are not exporting one single doses. And that we, EU, have been able to reach out with the Director General of WTO to support her agenda for the 3rd wave. And we're working with her, all the EU countries and the Commission, and with other partners around the world to support her idea. And she cannot be suspected of having a biased agenda for this, because it's true, and I'm not here to defend the Commission position, but if we make the vaccine available for free immediately, the investment will fall. So who is going to invest in the next Pfizer and the next Moderna and the next Johnson & Johnson to face the Delta variant? Who is going to invest for the next variant? Who is going to invest for the production we need? Because we know we don't produce enough this year. Where this investment come from, if not from the price of the vaccines? And it's not only a commercial argument, it's also to ensure that there is an incentive for this company to invest in it and to get the fair reward for the researchers also. How we compensate all this? By donating. because we know that 92 countries under COVAX do not have the financial means to buy this vaccine. So we pay for them through COVAX, and in parallel, we donate the excess of vaccine we may have. And I just reply on this. I see many figures flying around that we have bought 4 times, 2 times, that Canada has bought 11 times what they need, and that the Western world has by the whole production of 2021, letting the rest of the world without doses. I see the point, but I'm not sure it's true. I'm not sure 92 countries, EMC countries, would have the means to buy vaccine anyway. Now we are able to donate, but let's recall, we have not decided to buy 30, 20, or 40% of the world production. We are back to last summer, 2020, sorry, where no vaccine producer or manufacturers have discovered the vaccine. And we started contracts with all of them. And in the end, we were lucky, all of them find, in a way, except a few ones so far, find the vaccine. So we were legally engaged with all of them, and we signed the contracts with all of them. Not all of them are delivering the doses. So I'm afraid when I see that the EU will have 500 million doses, 700 billion doses extra this year in our fridge, it's not true. It's not true, because AstraZeneca is not delivering. Johnson & Johnson are late. Sanofi has not found the vaccine yet. So these maximum figures that I've seen have to be reduced to something that is more around 200 million or 300. And we are claiming that we will give to the rest of the world and to COVAX already at least 100 million doses. So we may be already giving almost half of the possible excess. And I'm not talking about the vaccination of teenagers in Europe. I'm not talking about the possible 3rd shots that we may need before Christmas. And I'm not talking about further delay that we may have in the rest of the year. Again, we are calling for a global effort and not about opposing continents like Europe or the Western world would be damaging the rest of the world. At the G20, the EU will call, and this is my last priority, will call for everyone to make an effort. Russia, China, the US, India, EU, these are the big 5, and that we progressively ensure a fairer vaccination effort. I see that Mexico, I see that Egypt, I see that Turkey, I see that Serbia, Azerbaijan, other countries around the world that are now reaching a certain level of vaccination also are donating to their neighbors. Australia and New Zealand for the Pacific, Taiwan and Japan for their region. So this is spreading. This solidarity effort is spreading, and this is very good news. I stop here.
Thank you very much. Well, you partly responded to that question, but we have a question from our public, from Patricia Magalhães Ferreira, and that was around that idea of leftovers. But maybe I will ask Celine and Alex to give their vision on that. It's a really sensible question, like Olivier was saying. And how do you see how do you react to that vision that we are giving our leftovers to the rich countries are giving their leftovers to the fragile or more poorer countries? And she also wants to ask you if how can there be an equitable and global access without sharing knowledge and technologies and patents, like Celine you were saying before. So maybe I will go before to Celine and then to Alex with this question from the public. Celine?
Okay, thank you. So on the question of leftovers, I don't think, firstly to say, personally, I don't think it's an entirely fair assessment to point to the EU's dose sharing as leftovers. I think it's a perception and it points to the need for support on so many levels. I mean, I've talked about the need to provide more support to health systems and frontline health workers. We know that the frontline health workers, and I'm talking about them again, but they play such an important role also in engaging with communities around vaccination and trying to dispel some of these some fallacies. So just to say that there's certainly, I think Olivier is absolutely correct that the vaccine hesitancy is a real issue. I mean, there is absolutely no doubt that it has played a role in pausing, or not pausing, but in slowing down the rollout of vaccination in many countries. But these are all issues that are part of a health system and a public health strategy, which is another reason why a lot of these countries need support. But the leftover issue is a perception, and it's a very real one. I mean, even reading the press in Europe, we've had so many challenges with acceptance of the AstraZeneca vaccine. So I don't want to minimize it. It exists, it's there, it's a perception, and it could, there may be a reality in it, but I think I do think there is a real, the point I was trying to make about leftovers is that we don't want to just appear to be giving leftovers, or it shouldn't seem that this solidarity that we should be providing from Europe, but not just from Europe, from all the rich countries, it shouldn't just be, oh, well, we've vaccinated our own, now we can just give a few leftovers. What we are trying to advocate for is a planned and global response of global solidarity. So that's the approach that I was referring to with the leftovers. I hope that's clear. Over.
Thank you, Celine. Alex, how do you deal with this issue and this perception of the leftovers?
Thank you, Helen. No, I hope we're not creating a perception of leftovers in the course of this discussion. But I mean, I think it's important to say these vaccines are critically needed, and they're critically needed now. These are not different vaccines. These are the same vaccines that are being used around the world. They've all been, COVAX does not provide vaccines that have not been WHO pre-qualified or licensed by a stringent regulatory authority. So these are these are the high quality vaccines, and I think the term leftovers runs the risk of implying somehow it's different. It's not. These are the same vaccines. But it is critical that the timing of doses is critical, and where I think that sense of leftovers is important is it is important that we actually are able to plan supply, and that we know what's coming, and because right now we're in a very supply constrained environment. That there are, unfortunately, the scale up of supply to the world's poorest countries has been much slower than anyone had hoped for various reasons. And there's no single reason for that. And in that context, it is critical that we have an equitable approach to how those doses are allocated, and that's why COVAX is so important, because it's one global solution to be able to equitably allocate doses across countries. And that allocation should be driven by who has greatest need. So that is the healthcare workers who are at most risk of exposure, and who also can be so critical to responding to this pandemic. To Celine's earlier point, that's important both from a public health point of view. It's also incredibly important from a gender equity point of view, because 70% of those health workers are women, and they are at highest risk. But it's also, but very soon we're going to pivot from a supply constrained world to a demand constrained world. We are going to see a very rapid ramp up in supply to countries around the world. We expect that could go as high as 400 million doses per month available to AMC eligible countries through COVAX by the end of the year, and that is a huge increase in supply. 6 to 8 times the number of vaccines that countries would typically be receiving through Gavi over that time period, and so the additional capacity needed to deliver those vaccines is huge. Celine spoke to this very eloquently earlier. To give an example, I mean, the WHO estimated that these countries would need 400,000 additional healthcare workers just to deliver those vaccines. And so the timing of supply and the predictability of supply becomes really critical in that context, because it's not just about the number of doses that countries receive. We're talking about health systems that have an upper bound in terms of how much volume they can deliver. And what we've seen in high-income countries is they've been able to steadily ramp up supply and delivery over time. And the risk in poorer countries is that they are going to receive vaccines when they become available, and it could be a much steeper ramp up in health systems that have lower capacity. And so that sense of where I agree with there's a risk around the concept of leftovers is if we can't predict, if we don't know what doses countries are going to receive through COVAX and when they're going to receive them, they can't plan. It's very hard for example, on hesitancy, it's very hard for a country to roll out an effective community engagement and demand generation strategy for a vaccine that they haven't received yet. The last thing you want to do is get people turning up to health facilities to demand a vaccine that doesn't exist. And so that predictability of supply is really important. So we're really grateful, for example, in COVAX for the 100 million doses that the EU has committed to provide, and that is incredibly valuable. But we call on all donors who are donating doses to really try and give us a firm schedule of when, and the sooner the better, because we'll have plenty of doses, we believe, 4 or 5 months from now. The doses, what we don't have is plenty of doses now, and countries have capacity to deliver doses now. So that's going to be really important. And the other thing that's going to be really important, and Sabine spoke to this earlier, is delivery funding. We are very grateful that we've received almost $800 million from donors to help support countries to roll out these vaccines, complementing $12 billion from the World Bank and funding from others. But I think we should all recognize the health system challenge here is unprecedented. And as Olivier said, it's not this year, it's this year and next year, quite possibly the year after. And if we need boosters, we don't know how long this will go on for. So we really need to ensure the resources are available and are being strategically invested to ensure that we're not just rolling out doses now, but we're building systems that can roll them out for the longer term.
Thank you, Alex. I will keep with you because we are talking about how difficult the process of giving those vaccines and the whole process until the inoculation is in fragile countries. So how does Gavi engage in context of fragility?
Yeah, thank you for the question, Helena. And I think if I go back in time, Gavi started as a pretty one-size-fits-all organization where we essentially said to countries, here's the vaccines that we support, and had a pretty standard process for how countries applied for that and how we rolled it out. And I think we've realized and recognized over time that in many different types of countries, but particularly fragile countries, we need to be much more flexible and adaptive to the unique challenges of fragile settings. And so we have been doing a lot to adapt and to learn. We are continuing to adapt and to learn. I don't think we would say we have fully perfected our support to countries. We can always do better. There is definitely a significant challenge around immunization in fragile contexts. We saw over the last 5 years that immunization coverage in fragile countries plateaued, whereas it increased significantly in non-fragile countries. And whereas about nearly 85% of children in non-fragile countries are now receiving a full course of basic vaccines, less than 2/3 are in countries at least Gavi classifies as fragile. So there is a gap there, and that's a gap that's really a focus for us as an alliance to help address going forward. In 2017, we introduced a new policy that was called the Fragility Emergencies Refugees Policy, and it was really designed to allow us to be much more flexible in our support to countries, to adapt what support we provide, how we work with countries, our processes, to meet their unique needs and their unique contexts. And it deliberately wasn't prescriptive because we recognize that every fragile context is different. I think while the overall progress I mentioned, unfortunately, we have not seen the progress on coverage in aggregate that we would like to see. We have seen that progress is possible, and actually rapid progress is possible in settings where you have a certain combination of factors. And those include really strong political engagement and leadership, a focus on time-bound and quite measurable results, alignment of development partners, and importantly, alignment of international funding and donor funding to a domestic plan. If I take the example of DR Congo, for example, the Ministry of Health developed in 2018 a plan they call the Mashako Plan, which was designed to focus on 9 of the highest or most vulnerable provinces in DRC, and to try and raise full immunization coverage in those provinces by 15 percentage points, which is a pretty ambitious goal. It had incredibly strong leadership from the Ministry and Minister of Health, and secured support from a number of development partners, including Gavi, who aligned their financing behind this plan, and then with a joint mechanism for reviewing progress and course correcting. And what's happened is actually since then, the country has managed to exceed the target it set. They've increased full immunization coverage in those 9 provinces by 27 percentage points. That's an additional 500,000 children who would not have been immunized otherwise, who have been immunized due to this. And that's in some of the most challenging regions of the Democratic Republic of Congo. So progress is possible, but it does take that combination of strong political commitment and leadership, and a willingness of development partners to really align themselves to that. I think what we've also seen is that we have to be adaptive in terms of understanding who has comparative advantage in these settings to reach communities and engage with them. Immunization is typically a government-provided service, and it's very effective in many settings that way. But there are settings where government services can't reach communities. And so in Afghanistan, for example, we worked with the government to develop a new partnership with the International Federation of the Red Cross and the Afghan Red Crescent to be able to deliver services and generate demand by engaging communities in regions that government services were not able to operate. And through that partnership, an additional 40,000 children have been reached. So I think that speaks to the need for everyone, every stakeholder, to be willing to look at how do we create the space to objectively identify the partners who really can reach these communities and support them to do so. We do need to continue to actively seek out new partnerships in this space, and particularly in these settings. And Gavi is actually about to launch a call for proposals to see, to identify humanitarian partners who may not be currently major players in the immunization space, but who can help scale up new approaches, especially in cross-border conflict settings, which is often one of the challenges with government-provided services, is where you have large population flows across borders. It becomes unclear which government is accountable for immunizing those populations and to track those populations. And so we need to look at situations like that, understand where the challenges are, and look at how can we find new partnerships and new models to reach children in those settings and reach communities in those settings. I also think we need to think more about demand, and we've talked about hesitancy, or as we like to call it, vaccine confidence, quite a lot in the course of this discussion in the context of COVID-19 vaccine. I fear the risk of this pandemic is that hesitancy, which was not a major issue in many countries we work with historically for routine immunization, there is a risk that that spreads from COVID-19 vaccines into routine immunization. And it's really important that that we take a much more deliberate approach to understand to responding to that, and that requires different approaches. Historically, we've relied too much on telling communities why immunization is important and why they should get it. And what we need to do is understand, why do they have doubts? What are their concerns? And how can we best alleviate those? And they're going to be different for different communities. And I think for us, really understanding that the demand side is as important as the supply side is going to be critical if we're going to reach some of these populations, because some of them, even in fragile settings, they're not, they can be within a kilometer of the national vaccine store. They could be living in an urban slum in the capital city, but they may not be seeking out services for reasons that actually have nothing to do with immunization. And often they have to do with the trust and confidence they have in those who are providing the vaccines themselves. And then lastly, I think just to bring it back to COVAX, one of the critical elements of of the design of the COVAX facility is the humanitarian buffer, which is designed to ensure that COVID vaccines are available everywhere they're needed, including in areas where they wouldn't be provided otherwise. And so areas, for example, outside government control or in instances of state failure. And that's something we're set up to be really flexible and agile, to be able to rapidly identify where are there pockets of populations who are not going to be reached otherwise, and to be able to respond rapidly. It is a measure of last resort. We don't want this to be we think it's very important that countries and governments take full ownership for their populations to the extent they can, but we recognize there are situations where that's not possible, and the humanitarian buffer is designed to step in where needed. So those are just a few examples of how we're trying to adapt our model to work better in fragile contexts. As I said at the beginning, I don't think we think we have all the answers. I'm sure some of the countries in the audience can give us feedback on what we could be doing better and doing more of, and we are continuing to try and adapt and improve. But we've certainly come a long way in terms of trying a range of new things and different things over the last few years, and we will continue to learn from that.
Thank you, Alex. So that hesitancy is really a major challenge you have to deal with, and having those local agents, and it's really important to have the trust to gain the trust of certain populations. But okay, hesitancy is a challenge, but to Celine, what do you expect the EU and the G7 leaders to do to support your work and to support fragile and poor countries in this COVID pandemic?
Yes, thank you. Well, the G7 Leadership Summit, of course, took place 2 weeks ago. And we, certainly as civil society, who've been advocating around the global COVID-19 solidarity, we had high expectations that the leaders of the world's 7 largest advanced economies would decide to take the fight against COVID-19 to another level and agree on a comprehensive global plan to end the pandemic. And we were disappointed by the outcomes from the G7, because we do believe that there's a need for urgent action and leadership from the world's richest countries. And we know that some action is being taken, but as I mentioned at the beginning, that it's just not sufficient. And yeah, the G7 communique, it really does contain some nice words and some sentiment of commitment around a collective goal to end the pandemic in 2022, which would be amazing, and to strengthen global action now to fight COVID, as well as taking further tangible steps to improve collective defenses against future threats and bolster global health and health security. Those are really important words and commitments. But while COVID is still raging and new powerful variants keep on appearing, we actually haven't seen any new financial commitments to end COVID globally. The G7 leaders made claims or claimed pledges that they had already made in the past without really concrete action to finance a global roadmap to end the pandemic in the coming months. So we believe that the Access to COVID-19 Tools Accelerator, Act A, is an absolutely critical initiative. And it is facing a US $18.1 billion funding gap, or an estimated $18.1 billion funding gap. And the latest estimates also anticipate that it will cost between 50 to 66 billion US dollars to fully vaccinate the world. And likely actually much more when these end-to-end delivery costs are factored in. So to answer the question of what the EU and G7 could do, we call on them to fund all pillars of the Act A, this Access to COVID-19 Tools Accelerator. And not just COVAX. COVAX is absolutely essential. There's no doubt. That is the vaccines pillar. And I mean, we've heard from Alex on the amazing work that Gavi's doing around that, and it's just so important. And of course, we're grateful for all of the solidarity that has already been shown. More is needed, but not just COVAX. There are other pillars related to diagnostics, testing, and treatment, and also the health systems connector, which is one of the pillars which could provide some more support for delivery. So that would be really our key call. I've already mentioned the other areas that I think are very important around public health systems strengthening and funding, and of course support to the health workers. So I think for now my key call at the moment will be around Act A pillars being funded.
Thank you. But what do you think is lacking? Is a lack of will from the governments, or are they lost in discussions like Olivier was saying, endless discussions on how to help and to proceed, or is it really a lack of will?
I don't think it's that straightforward. I do personally believe of course it's very complex. There are so many different perspectives, and there are so many different interests, and of course, I mean, there's always the question around public sentiment versus the sentiment for solidarity. There are questions around prioritization. I mean, there's just so many questions around this, and so much misinformation. I mean, we've been talking about vaccines hesitancy and other issues. We do know how to address some of these problems or challenges, let's say. And as Alex mentioned, just the need for proper planning and around vaccine supply. But of course, decision makers and the EU, for example, is a very complex decision-making structure. Of course, there are so many interests and considerations within this. And interesting as well on the whole issue of intellectual property rights and patent sharing. I think Olivier very convincingly presented a perspective of the need to preserve the motivation or the incentive, let's say, for pharma to keep producing and research to keep producing new vaccines, because there are constantly new variants. There's a flip side of that there are other approaches or potentially other approaches to addressing the development of medicines as global public goods. So just to say, I think there are many perspectives. Some of it is absolutely political will. I'm not convinced that the entire public of rich countries and nations are really have the solidarity imperative as a top priority. But I also know, I mean, as Olivier said, a year ago, we were in dire situation in Europe. I do think, however, we could turn things around and get that political commitment and public support if we were also able to share more information about what is happening across the world. That so many countries are now facing situations as bad as or actually much worse than what we had in Europe 1 year ago. So yeah, I mean, political will is needed, but I don't want to suggest that I'm aware that it's not a straightforward issue. It's very complex, but at the base, I do think, at least in Europe, maybe I can speak as a European, I do think that we do have some shared values to support other human beings and around solidarity, that we could perhaps be drawing on more to ensure that we have the political will.
Thank you, Celine. Olivier, what do you have to answer to Celine? What can the EU do more?
I think Celine is right in the fact that it's not a problem, I think, of pure political will. I think when it comes to European values, solidarity, the responsibility of Europe towards the world, we have strong values. We based our international action on them. We are quite even proud of being or trying to lead these global efforts. We are also very humbled when it comes to the magnitude of the challenge. This is why I'm saying that this will not stop by Christmas this year. So we have to ensure that we have the means and the determinations and the political stamina to continue these efforts for the next year and maybe, as Alex said, for the following year. This may be the task of the mandate of the EU institution till the next European elections. And at the same time, our leaders have to ensure that the COVID-19 pandemics will not hit our continent again after the summer. And all this. These concerns are not gone yet. So it's a delicate balance for our leaders and for our institutions to know which efforts are needed and at the right time. But I'm certainly agree that it's not a matter of political will. It's more the difficulty to assess the situation and to move in this very delicate environment. And we don't know the future. Let's also face it. I agree with Alex. It's important to plan and to give to third countries a sense of programming so that they can prepare their campaign. But the future is not written, and this pandemic, being the unprecedented, doesn't give us the full chapters of its history yet. We have to evolve and be very flexible in our answers in the coming months, and especially after the summer. We don't know if vaccine manufacturers will be up to their legal and industrial commitments. We don't know which variant will come. We don't know if the heat that we see now of COVID-19 in Moscow will be a problem for the whole Russia or only for St. Petersburg and Moscow. We don't know if the situation in Africa will be limited to some countries or will hit the whole continent. We were lucky for Latin America. We saw it in Brazil and a few countries, but it did not spread to all Latin America. It seems that China seems to control this. It was quite unprecedented and maybe sometimes unbelievable. Let's see India. So voila, there are a lot of variables that are quite difficult. So with all the political will that we want, we have to admit that we don't know the future and we cannot face the situation alone. This is why I think the European answer is limited but correct. It needs the world to vaccinate the world. Only multilateralism, cooperation, acknowledging the contribution of China, of Russia, of India, of US, of COVAX, of WHO, of ACTA, all that are elements that goes in the right directions, and we need to have this discussion globally. This is why we hope that the summit, the United Nations General Assembly in September, led by our European Secretary General of the UN, Mr. Guterres, who was in Europe last week, the G20 presidency, Italian presidency of the G20, and the summit in October would be important moments of multilateralism with a strong European lead to ensure that we move forward in this multilateral and global efforts. This is our hope. This is where we will put our efforts. And I think, to be honest, that after a while, what we started the conversation with vaccine diplomacies, this is a bit fading away. It's true that China is still donating to key countries that they have an interest, but in total, China has donated less than 20 million doses to the world. They export 400 million doses, which is much more important. It's a commercial interest. But this tactical move of trying to donate to those who recognize Hong Kong or not recognize Singapore or Taiwan, this is secondary. I think the contribution of China, for example, if they are really vaccinated so far, 700 million Chinese citizens, and if they are exporting 400 million doses, that means China by itself has been able to vaccinate around half a billion people on the planet. If EU has been able to vaccinate so far 1 or 2 doses, around 300 million people in the EU, and if we have exported around 400 million doses, that means the EU in 6 months have been able to vaccinate around 250, 300 million people on the planet, especially in the EU. But if you put all these efforts together, but China and the EU are close to 1 billion people around the world vaccinated thanks to this. If the other can join this, and if we add another semester of 2021, and if we add the effort of COVAX, which hopefully will be able to deliver on its very ambitious targets, which we hope if we meet again in 6 months' time, or if you invite us next summer, I'm sure we will have done huge progress. It takes time to vaccinate the world. This cannot be done in 6 months or in 1 year. So let's be humble also on this, and let's all do our best. That would be our priorities, to be honest.
Thank you, Olivier. One last for each one of you. One last challenge. What was the biggest challenge of this pandemic for you, and what is the biggest lesson learned in the last 1.5 years? Really quick. I start with you, Olivier.
Well, I think the main challenge was for the Europeans to overcome national reflex and to work together. Everything starting in Italy last year, and we all think that it will stay in Italy. Wrong. We all close our borders. Wrong. So that is probably the main lesson in every crisis in the EU, where everybody thinks that they will be safe. So it's an important lesson learned. And where I was most impressed, to be honest, is to see how comprehensive is our answer and how we are able to speak to everybody around the world when it comes to vaccination. We have not alienated anybody, and we are ready to work with anybody and to help those who in need. I think that is a very important lesson and a very positive message also coming from the EU. Thank you.
Thank you. Céline.
Thank you. Goodness, that's a difficult question. A lot of challenges. I'm going to speak with my CARE International hat on as a humanitarian and longer-term development organization. The biggest challenge, I have to say, was that we faced really an unprecedented global humanitarian situation with this COVID-19 pandemic, because we've had the health situation, but it's been compounded by so many other impacts, and that's maybe the other thing, is that while we need to address the pandemic through a global health response, we also need to recognize the impacts on hunger, on our economies. I mean, the scale is just so vast. And for us as humanitarians, I mean, we really had to work around the clock to ensure supports. But of course, you know, I'm slowly optimistic that we're going to at least start to move forward. But as I said, I really think we need to be more ambitious and move more quickly. And yeah, for that, indeed, political will be important. Yeah, thank you.
Thank you, Céline. Alex?
I think the biggest challenge for everyone, whether it's countries, partners, or Gavi, from my perspective, has been we've been trying to do what we were already doing, which was immunizing and delivering health services to hundreds of millions, billions of people routinely around the world, and ensure that continues. And in fact, we continue to ideally progress and reach those who were not being reached, and at the same time stand up an unprecedented effort to immunize the global population. And I think that's that stretched everyone at every level of every system, and it continues to stretch everyone at every level of every system. And it's, it doesn't matter whether, my country, the UK, is blessed with the NHS. Even it struggled to do that. And those problems are even greater when you look at countries that aren't lucky enough to have such strong health systems. And so that, I think, not losing sight of the fact that there could be even more deaths from other diseases than from COVID-19 if we don't manage to maintain those services, and maintaining a focus on other health problems has been one of the biggest challenges, while also making sure that we do get this pandemic under control. I think in terms of lessons learned, I'd love to say we have loads of lessons about our state of readiness. I think the reality is we actually knew many of the things that we could have anticipated, many of the problems we've had. We've certainly learned a lot, Gavi and COVAX, about what it takes to do what we've tried to do. This is the first time anyone's tried to set up a global mechanism to buy and deliver vaccines for the world. And that has been, we've got some things right and other things we've not got right. And we've learned a lot from that. But I think one thing we've certainly learned is that it's needed. And it is absolutely epidemiologically certain we will have another pandemic. And we need to learn from this pandemic what worked with a multilateral mechanism like COVAX, what didn't work, and how do we make sure next time we're ready because we've fixed the problems and that we have the mechanisms in place, the financing in place, the delivery systems in place to be able to respond rapidly.
Thank you, Alex. Well, thank you very much to all of you. It was such an interesting discussion and such a good way to learn more about your work and how we can learn from these pandemics for the future, because we will have challenges ahead. And I will close with one of Olivier's sentences. It needs the world to vaccinate the world, and I think it resumes quite well the challenge ahead. And we are almost ending this conference. The closing remarks are being with Francisco Seixas da Costa, Elder da Costa, and Augusto Santos Silva, our Foreign Minister. So thank you very much to all of you to participate, and to our audience to be with us. Thank you. Obrigada a todos.